Welcome to part one of the Practice Management Secret Series for the iAct course. I'm your host, Paul Spaziali, and today I have as my guest Dr. Rob Bond, co-founder of the Canadian Straight Wire Orthodontics course and the iAct Practice Management course. Welcome, Dr. Bond.
Thank you, Paul. Glad to be here.
Great. Today I thought we would go over the number one secret to attracting and retaining new patients and expand on some of the bullet points in your course brochure here, how it benefits other dentists and what's in it for them.
Sure.
Okay. So if you had to boil down the very core of all the material and extract a strategy that will generate the most impact in a dental office in the shortest time, what would it be? What one thing would you classify as the number one secret now?
Well, Paul, there's never really one secret to attracting and keeping new patients. There's actually about 50, and it's not anything to do with expensive TV, radio, or social media advertising. It's consistent and convenient customer service and caring. These are all things that we will discuss in the course, like comfort calls and the WOW initial exam for the new patient coming into your practice, and handwritten letters daily to patients done by the doctor. All of these little secrets all start the patient thinking yes to treatment that they need and help them want what they need.
Excellent. That's very fascinating. So what you're saying is then the number one secret is kind of a merge of all a bunch of different things that you could do.
Well, all the things that we've put together over the course of my 43 years in practice and listening to other dentists speak about how to garner new patients, that's where all this comes from.
Excellent. And you'll be going over that in the course.
Absolutely.
Okay, great. And I'm sure the other doctors and their staff attending will have a lot of questions about that. But speaking of the course, why are you holding this anyways? I know you've been practicing for 43 years, so why are you doing it?
Well, as Gordon Christensen once said, he said, most dentists learn how to do dentistry really well, and then they die. Most dentists are not very attuned to the business end of the profession, and I felt that after being in this business for 43 years, I think I'm pretty good at what I do now, and I wanted to pay that forward. We have been asked by several dentists during the course of giving our Canadian Straight Wire course to expand a little bit on some of the things that made us so successful, and we put it all together here in a nice, neat little package. It's really astounding to me that in the U.S. only 3% of the dentists that retire can stay at the same level that they're used to when they're working full-time. They just can't physically retire. I'm doing this now because I like to do it, and learning, if you want to really learn something, you really have to be able to teach it. So from Dr. McDonald's practice, I've learned a lot of things, and his presentation will deal with estate planning and trusts and investing, and Don's part of the course will teach you how to run a low-overhead, multi-million-dollar practice, and Sean certainly will help you resolve conflicts and how to make your staff happy and keep them that way. So it's a good group that we've got going, and I think we're all in this not for the money, certainly. We're in it because we would like to give back something to the profession that's been so good to us.
Well, that sounds like a noble cause. And the other doctors will undoubtedly get tremendous benefit from it. So what is your goal for your portion of iAct? How do you want the students to walk away from the course when they're finished?
Well, I'd like the doctors and their staff to be able to take some actionable steps to achieving their goals. We're going to talk about goal setting in my portion, and I think that's where it all needs to start, with their staff. Try on some of these new ideas that they're going to hear in the course. I want them to feel energized and realize that dentistry is not only a service, but it's a business as well. Most of the doctors, I think, have to get over their Willy Loman complex of thinking that everyone has to like them on their staff. The docs need to be leaders. They need to learn and how to parent their staff to get the most out of them, because if we don't make any profit, they don't get paid.
Right. Okay. So with regards to that, and speaking of the benefits of the course, do you mind if I just go through the bullet points on the iAct brochure and you can briefly elaborate a little on them?
Sure, Paul.
Okay, great. Just wanted to give the listeners another taste of what your portion of iAct is all about. Okay, so we have attracting new patients and retention is the key. So the first one is increasing new patients equals increase of cash flow.
Well, increasing cash flow and attracting new patients all comes from working smarter, not harder. We need to get the patients to say yes to what they really need. There really is no thing as bad beer, and there's really no thing as bad patients. We love them all equally. Most dentists need some new verbal skills to make this all happen so patients will say yes to what they really need.
Excellent, excellent. And where do you get the most bang for your buck when marketing?
Well, you know, Paul, in my experience, the best bang for your buck is really not external marketing, but internal marketing, and the little things that will teach the doctors to do to entice their patients to tell other people about them, because the word of mouth situation is certainly the best marketing we do internally in our office.
Excellent. And then the next point is, what has social media got to do with dentistry? Everything.
Well, it certainly does have everything to do with dentistry, and my advice to people that are looking at doing social media, Facebook, Twitter, YouTube, the rest of it, if you're going to do it, you need to do it right, or don't do it at all. And I think most of us, we're dentists, we're not social media gurus, and as soon as we get over that and can actually say, I hate Facebook, and get someone to help them with this media, I think it would be a great boost, especially for people that live in the GTA or in the bigger centers of Ontario.
Excellent. And then the next point is, what are your financial and business goals, SMART? I'm assuming that's an acronym.
Well, SMART goals stands for being specific about really what your practice wants to accomplish, and the M stands for measurable, and these goals have to be measured, so you have to have some data from years before, so you have to start collecting that now. The goals have to be attainable. You can't develop a bonus system for your staff if you don't have some attainable goals. They just won't go along with that. And the R stands for relevant. The goals have to be relevant to your style of practice. Not everyone is going to use a CAD/CAM machine, nor are they going to use digital radiography and do Invisalign. So they have to be relevant goals. And then lastly, the T stands for trackable. These goals have to be tracked, and not only by you, but by your staff or your front desk person or your office manager.
Excellent, excellent. And office manuals plus compliance equals efficiency?
Well, you know what? You asked me earlier about what was the most important thing they're going to learn, and I think that probably having a good office manual and protocol manual is an absolute must. It defines the rules for all of your staff. It lays out procedures that need to be done specifically, and it certainly stops conflicts in the office when you have everything in writing and everybody is on the same level playing field. So these are essential in my office.
Excellent. Okay. And the morning huddle avoids the puddles?
Well, you know, as I fly with private pilots sometimes when I go fishing, and I don't want spontaneity from the pilot that's taking me up in the air. I want to know he's followed his protocol checklist, just as we need to follow a checklist in the morning. I want to make sure he's got gas in that plane, he's checked the ailerons and so on, and that's what we need to do. We need to start producing at 8 o'clock. That means the girls aren't in the bathroom primping their hair and brushing their teeth. They are ready to go at 8 o'clock. So that's the morning huddle, and everybody should be at the office at least a half an hour before start time to participate, everyone in the office.
And office protocol and extraordinary customer service.
Well, you know, this whole realm of thought about protocols and customer service, that's all in the manual that we're going to discuss, the protocol manual. And we'll give the students some very specific pages that come out of those manuals so they can construct their own, because every office is different.
Excellent. Okay, and finally we have tips to reduce your overhead and apply it to your marketing.
Well, I'm going to give the guys about 20 of those that we've learned over the years, and these are 20 really significant things that can reduce your overhead and also make you practice a little more efficiently. Just a couple of examples, one of them being the doctor should sign all the checks in the office. If that's done, you're going to save about 1% on your overhead every single month. And inventory control, another little trick that we use in our office, is to date everything that comes in the office on the bottom of a bottle, on the side of a box, when we bought it, how much the cost was per unit, and how many we got. So we can check our inventories and keep really close watch on that. That's just 2 of the 20 or so tips that I'm going to elicit during the course.
Excellent. Well, it sounds like you have a great lineup there, and all of our listeners that want to register for the course, how would they do that?
Well, all they have to do is go to www.dental-profits.com, click on courses, and then click on the registration button below the practice management course.
Okay, great. Thank you very much, Dr. Bond. It was a pleasure speaking with you.
Well, likewise, Paul, and thank you.
Great. Now join us for the other parts of the Practice Management Secret Series for the iAct course. We have next Dr. Alan McDonald on business of industry, including corporations and trusts and reducing overhead. Then we have Dr. Don Foster on low overhead multi-million-dollar practices. And then finally, Sean Bayless on staff management and the key to retaining a great team and having lots of fun in your dental office.